You're not alone, together we're real strong.
Hello, Dr. Lemmo.
Hello there, James.
Wonderful, and good to see you today.
It's always a pleasure.
Excellent. And the we were going to talk about mistletoe. I get lots of questions from patients regarding mistletoe treatment therapy, and if you could explain a little bit about that, that would be that would be great and most helpful.
Okay. So mistletoe. Sorry about that. As the name implies, it's when you hear about during Christmas time and
Right.
kissing under the mistletoe tree. It is that it's a parasitic plant that they grow it on different trees, and that's why they have like different mistletoe preparations. Like say mistletoe P for pine, it came from a pine tree, and
Okay.
Q quercus oak tree, and M mele apple tree. It's probably one of the first immune system treatments that was. I think they had a product in Europe. I think it was in Germany or Switzerland in the 1920s.
Oh,
So
okay.
it's really old. It's not new, and it was kind of used by the community, like even MDs and stuff, as this regulating treatment, which kind of spilled over into helping with cancer.
Okay.
So that's why, with that long track record of use in countries like Germany, like I remember seeing, like for advanced cancers, insurance pays for it.
Oh,
And yeah, and I remember when I went to Germany over 10 years ago, I went to check out one of these mistletoe companies, and I go to one of these hospitals. It was a smaller hospital, and like mistletoe was on the wall, like as a treatment that they provide.
okay.
So and then you'll find that different countries like really resonate more with it than others. Like say Korea, like South Korea, they're pretty advanced there these days. Like they have mistletoe that's approved for medical use, which is
Okay.
why you're seeing more research coming out of Korea. And like I remember one was telling me they even use it like if they have like fluid in the pleural lining to try to fuse things. It's called pleurodesis. I think mistletoe is one of them is used for that there.
Okay.
So what I'm trying to say is that it's not a new treatment. It's an older treatment. A lot of the more, I guess, research versions come from Europe. So, like, say, Germany, Switzerland.
Okay.
And there's probably, like about three companies that come to mind that make it. So there's different competitor companies. And it's got this ability to help to improve quality of life in patients, like meaning so for pain, energy, appetite, those kinds of things.
Okay.
And then there's it's ongoing discussions and debates for it to actually help to fight cancer.
Okay.
So like for myself, I've been around it for over 20 years. And so it's not a new one for me. I'm finding now, because of the interest in immune system treatment, because now
Mhm.
there's like patent drugs, checkpoint inhibitors and things so now it's like the immune system has been a bit more validated, that you're seeing more discussions about it, more and more. And so as a consequence, you're seeing its creative applications. So normally mistletoe is given by injection, like how a
Okay.
diabetic would with insulin. It can be given in the skin, and it can be given, like say, every second day ongoing.
Okay.
And so that one's a popular original use where people would just be instructed how to use it, and then people were say doing it at home, ongoing for home use, or some clinics are administering it for them and they're coming back. Then there's like the intravenous application where you could add, like the nice thing about the IV applications that you can put a lot more into the blood and make it more stronger as needed.
Okay.
And then there's even people talking about it, putting it like in tumors, by tumors, putting it in like in the peritoneal cavity if you have like swollen abdomen, or in the pleural lining, like if there's fluid there. So I've done that in the past.
Okay.
So there's a whole like way of how to use this thing. And so all depending on, your patient and what makes sense to them, and what they can handle and not handle.
This seems like it's a fairly staple item or treatment for cancer patients. Is that correct or incorrect?
Yeah, it's kind of it's these days it's kind of been viewed it's being viewed as something that's can cross over to many cancers.
Okay.
And because you're dealing with not like a single ingredient. So in essence, like I think part of the problem why mistletoe has been slower to catch on to the more conventional community, because they're always about single ingredients, like this one specific drug, and maybe combining 2 or 3 or 4 different single drugs. In mistletoe, it's a plant ingredient. So there's like 50, 100 ingredients in there, right? Like it's a plant extract,
right?
It's like if you take tea and you kind of put it in water, and it's like, it's got these colors and smells, right? It's like it's got like more than one ingredient in it. So that one part of it, I think conventionally, they're always never resonated with that, right? But so as a consequence, like it's like it has multiple properties, and which could be used on a multiple application. So like if you look in these books with mistletoe, they'll give you, okay, so for breast cancer, this is the one we recommend. For prostate, this is the one we recommend. For colorectal, this is what we recommend. For this one, this is what we recommend. They have this whole book as a guidelines on how to use them, which ones to use, and away you go with it. Which ones, like say, you're using more with conventional treatment, or levels of standard of care. Which ones with surgeries, pre and post. There's a whole universe in it.
Now is it used to shrink? Is it used to shrink tumors?
It can. So it obviously, these are the debates with it, right? But let me tell you a story. My very first patient that I used intravenous mistletoe was a patient with advanced stage 4 colorectal cancer.
Okay.
And so this is over 20 years ago now. So I always remember my earlier cases because they were new to me.
Right.
Now I'm a bit more numb, unfortunately. But,
No. Right.
but anyways, so this guy, back then, also the toolbox in colorectal cancers was a bit smaller than now. But, and he was doing really well with stage 4, like cancer in the lungs and other places, and alive for many years. But the cancer started to adapt more. And he was doing like the classic injection in the skin with mistletoe later on. But it seemed like things were starting to wear off. And so I go, well, I hear you can apply this intravenously, but it's not talked about. So I remember the companies in Germany, they were like, well, we more recommend the injecting in the skin. However, here's some data for you, IV.
Okay.
It's kind of more the underground data,
Right.
And that's what people don't know. There's like above ground data, and then there's underground where people are curious about using things, but they don't always talk about it a lot. Anyways, so I started then, and he had this kind of tumor by his, like under his chest area that was a bit red. And so his tumor marker, the CEA, was like just climbing up, right? Like so implying that the cancer was on the go. So I added 1 vial of these mistletoes to his bag. I think it was like 100 milligrams. And then I go, okay. Then I was like, next time I added 2. And then when I got to like 3 or 4, something happened. The tumor on his chest started to throb, room,
Oh,
which he could feel. And then at that time, I was like, is that good or is that bad? Right.
right.
And then, but also happened, his tumor marker that was going like this plateaued,
Great.
stabilized.
Great.
So what do you think it was doing? It was actually the cancer was being irritated, like, and I always remember his oncologist going like, "You're doing something," like, and this is outside of chemo, right? No
Right.
chemo, no nothing, like it was all alternative stuff. So when you ask me, this question, could it help to like target cancers? It can.
Okay.
Like anything, is it everybody? Like no, obviously not, but
Right.
there's groups. And then there's its ability to like improve quality of life that probably does it in a bigger group.
I was going to ask you about that.
Yeah. Yeah. And when you improve quality of life, I think as we talked about in the past, you could actually improve their survival,
Right.
and so I think it can do many things. And then I also have like I remember a patient where she had this breast cancer that, she was a more senior. She didn't really want to do surgery. And so I injected actually the mistletoe right next to it. It was called peri-tumor. So just not in the tumor, but just next to it. And you know what happened? Her body started to like I think her bowels started to get a bit more like flared a little bit. But you know what happened to the tumor? It shrunk in half. You know what I
Wow.
mean? Yeah. So it was just this like, I was just being more creative with it. Again, that's my earlier cases. This is like over 20 years ago things, but so, it was just one of those scenarios where you're trying to help somebody. They weren't
Right.
into surgery. They weren't into, she was like, older. And so I was like, okay, like maybe, and she was into mistletoe. I said, well, this is experimental. There's not really like a lot of any papers that I'm aware of at that time. I haven't looked, and I go, but people are using these things creatively in their own
Right.
clinics. And that's what we did. So I kind of think of it as a tool, right?
Okay.
And that's why a lot of clinics and centers incorporate it into their treatment plans and programs because there is this long historic use. There are these companies who've been making it for many years, and some countries are more into it than others. And as I said, like, some countries insurance pays for it. And
Is it mainly made in Europe or no?
the ones that I'm more familiar with is yes, right? Like, so like there's like say 3 classic companies like Iscador, and Helixor, and there's Abnoba. Those are the
Okay.
3 that I'm more familiar with. And like so Iscador, where it was quite popular many, many years ago in the United States is because Suzanne Summers, that actress,
Right.
she talked about it like back then. And
Okay.
so she actually put that on the map in the United States like many years ago. And and I remember her like being on like CNN and all these
Right.
things back in the day,
I
just
remember that. I
yeah,
remember that.
yeah. So it's again, it's not a new thing. It's an old thing, but it's like anything. It's never always given the time of day, and they're always talking about what's the research, what's the this, what's the that, and we're not
Right.
happy with this kind of research. We want better research. It's all this stuff. But then you have like say, I said, Germany insurance can pay for it. South Korea here, like specialists are playing with it for like surgeries and
Okay.
minimizing the immune suppressive parts of surgeries to keep the body immune more supported, more stronger. So there was a paper that I think I talked about with that research in some pancreatic cancers, and so it's really it's an interesting area, but and
Is it
so
used just in in cancer or other illnesses as well, like Lyme disease seems to be really prevalent now here in the United States. I would imagine it's spread all over the place, but is it used in other conditions other than cancer?
There actually is. There is this growing interest in use. Like I remember, like years ago, I was talking with a medical doctor from London, and he was part of some integrative hospital over there, and they were using it for hepatitis B and C. You know,
Okay,
yeah, and then you're hearing about it like used for treating, say, arthritis.
okay,
So it has this immune regulatory properties, right? And
okay,
so while I guess the bulk of the interest has been in cancer or oncology,
right.
it doesn't mean it doesn't apply to other areas, you know? And so while say Lyme's disease is not my specialty, I'm sure it's like just like the doctors with hepatitis B and C in the UK back in the day, they're using it for all kinds of infectious potential.
When when I'm talking with patients all across the country, then a common question is, they're really asking, what is the go-to, treatment, for my cancer? And when you're dealing with an integrative and holistic basis, it's a big, huge toolbox. I mean, there's a lot of things that are in that toolbox, and you would never have thought about the plant you see around Christmas time. That young men use to steal kisses are what's being used to get help out with cancer, right? So
Yes,
that's what it's just really interesting, and patients can actually get the injectables and go and take and do it themselves. Is that correct?
that's correct. Yeah, they can.
Wow, wow.
Yeah, yeah, they can. It's like that's like, if you go to say pharmacies in Europe, like yeah, they'll have them. Here you go. Like some
Okay.
countries are more into injecting than others. So like it's more common just practice. Like a lot of medicines are provided by injection, but yeah, it could be that simple. The only thing with mistletoe is when you're injecting in the skin, there's this protocol of using it, and what that tends to entail is these injectables, they can come in like vials that they get stronger and stronger, and the reason for that is you tend to increase the injection of mistletoe until you get this red mark on your skin, right? So
Okay.
where you injected. So it's like, say, the size of like a quarter or a nickel or something. And that red mark tends to correlate or coincide with, oh, the body's saying, I see this. I'm responding. I'm engaged, right? Because
Right.
say between you and me, James, like our immune system and dose response could be very different, like,
Right.
I might need like say more than you or vice versa, right? So once you get that red mark, like that's the signal where it's like, and it could feel like irritated. It could feel
Right.
very, it's red. As it dissolves into the body, it feels like this little hard lump that just starts to shrink away, right? But so that's the only thing in the to be aware of when you're injecting the skin with it is like there's a little bit of playing around with the dose. And
Okay.
then you're just using it like ongoing. Like say for me, like I always tell people, like the abdomen's the easiest place, and you're just like moving it around.
Right.
Like some people, if there's like tumors by like that area, I was like, well, you can always cycle it around there, or by your liver, but yeah, that's it's
Every couple of days or so, the injectables are being done.
yeah, like that's kind of how it's classically used, and there's like obviously exceptions to the rules, but like if you say, for example, give yourself like a big dose, like a big reaction on the skin, then you need more time. You can have more time just to calm that down. So
Okay.
there's been some protocols that they're giving like big doses like once a week, for example. But I would say the more classic way is like doing it, say, around 3 times a week, like every second day, 2 or 3 times a week.
And you can do
That,
a higher dose with if you're doing it with an IV.
yeah, like because like imagine like if you're when we're talking about the skin and you're inducing this red irritated spot,
Right,
the skin can only handle so much, right?
right,
Like so if you use the like the doses that you would say give IV, if you did on the skin, you could have a big welt, you
right.
know?
Okay,
And so that when you go right into the bloodstream, like it's just like when people get chemo, it handles a lot. If you injected that in the tissues, it could, burn it or irritate it, right? And
right.
so the IV that has this capability of just of handling more, and I think if you ask my opinion on it, I think when you're in my mind, when you're giving the injection in the skin, it's more like I think the effect is more immunological, like meaning like that your skin's your first line of defense. So when you inject it, then the body is sending signals all over the body to
Okay,
kind of get ready, get prepared, heighten this, heighten that. But when you give it IV, I think the mechanism more is that the ingredients themselves have the ability to irritate the cancer, like because it's
okay,
floating around. And I think the immune system part is secondary, you know?
okay, okay.
So, and I know this because I've had some like patients where they've had like dramatic tumor kill. And like I remember this patient with a form of sarcoma, like a uterine, it's called leiomyosarcoma, like it's a sarcoma in the uterus, and it was advanced. And this was an alternative, again, no conventional treatment. And she had this big tumor. And then she goes like, yeah, my pain went away, Walter, and all this stuff. So, anyways, when they analyzed it on CT scans, the inside of it turned to like jello.
Really?
Yeah, it turned to mush. And so it was like going in there and just somehow irritating it, but it did it in a way that even the radiologists were not used to the kill pattern. They were like, it's like this is weird, you know? It's like it turned into this like mushy thing, you know?
Right.
And they weren't used to that pattern, you know? Like it's so, but obviously for me, it was like, yeah, it did it in some weird immunological way, you
Right.
know,
I love hearing stories about people getting their lives and their health back, and it happens all the time, right? So there's always these other options that are out there that traditionally maybe your oncologist isn't exploring with you, right? So the toolbox is a little bit smaller, right? And then you can go to an integrative doctor where there's just a lot more options to choose from.
that's right. And also keep in mind from the standard oncologist community, it's just not their world. You
Right,
know, it's just not their world, right? Like they're just too busy dealing with what they know and what they deal with. And then so to put this additional pressure on their shoulders that they're supposed to know more than that,
right.
it's just not fair to them too.
Understood.
Yeah.
Yeah, that's that
Yeah.
that that makes sense.
Yeah. So
And yeah, I like seeing that there's all these, these other options that are out there other than having to go, I give up, right? It doesn't have to be that way. There's so many other options that are out there. And realizing that mistletoe's been used for so many years and with all these different applications. So uh I enjoy hearing about all these other options that people may not even be aware of.
yeah, and I think that's what I really appreciate about the awareness that you're trying to create. But like, yeah, so just imagine this mistletoe's been around for like over 100 years, and
Right,
so
right. And
definitely
it's
not new.
no, it's not new. And I think that it's different in what's a I think the mistletoe that's being used different than what we see in the United States in the trees versus the mistletoe that's being used in, farmed, I guess, or in Europe. And I think it also depends on the tree that's growing in because it's a parasite, right? It's a
Right,
parasite.
it's a parasite. Yeah, it's a parasite plant, right? Yeah, so these companies they're obviously in Europe, like yeah, they cultivate them, they extract them, they do all this stuff, right, with them. and to make it into an injectable grade that they typically come in these glass vials that you crack open.
Okay.
So yeah, it's and that's why they're not so polarized to it. Like as I said, when you go to say countries like Germany and certain
Right.
hospitals, they're like, "What's the big deal?" And
Right. Well, I know it's commonly used in integrative setting, and I'm asked about it, and I would think that I would be asked about it more often, right? So because of how it seems to be a fairly staple option in an integrative setting, which is I want people to know about it because there's so many other options that are out there.
That's right. Yeah, and I would say in these days it is a more, I guess, one of the foundational kind of treatments that's being provided out there.
Okay.
And then just keeping in mind that it also could be used creatively. So not only injecting the skin, say for home use and IV, and then there's talk of it putting it into the regions of the body as
Right.
well, right? So it all there's a whole kind of creative potential use of it, and but you can't go wrong from like the basic, injecting in the skin and then away you go with it, get you started and go. And again, and its applications are just manyfold. It's not only just in the regulating the body, the immune system, and anti-cancer potential, but like surgeries, right? I remember we talked about biopsies, right? Like those weaken you, right?
Right.
And that's why, again, there was some curiosity in Korea, one of these papers of just revolving it around surgeries to just try to
Okay.
help keep the body supported, and to try to hopefully minimize the immune suppression that is commonplace with surgeries and procedures, and trying to see if that could help to regulate, these more pro-inflammatory environments because of the surgeries and procedures and stuff. So it could be used in many, many scenarios. And so it doesn't have to be just for, quote, for someone with an advanced disease.
Right.
It could also be used in people on the various earlier phases of treatment, and trying to help them there.
Yes, surgery is nothing to be scoffed at. It's that's invasive, right?
Uh,
So I've had surgeries myself, and I can tell you, I didn't immediately, pop back, after surgery. So seeing these other options and bringing this to light for people so that they know that there are these other options that are out there, and they can discuss these with their integrative doctor, while they're even thinking that they might possibly have a diagnosis of cancer. That's the time to be getting involved, not weeks and months later. Go in and discuss these options so that you're starting off with an education, and knowing that, hey, it doesn't necessarily have to be chemo radiation surgery, or you could do other options along with standard of care. So to help improve those odds.
yes.
Wonderful. I look forward to our next conversations, and it very very enlightening. I get these questions all the time, and thank you for answering them for me.
I'm here to help, and thank you for creating the awareness. And
Uh,
so
awesome, Doctor. I appreciate you. Thank you very much. A very just another very helpful conversation. I appreciate you.
all the best.
Thank you, sir. Bye bye.
Bye.
Thanks. Appreciate it. All right. Take care.
All right, all the best.
Yes, sir. You too. Bye bye. I hope you enjoyed the video. If you're in the need of integrative and holistic treatments for you or your family member, please feel free to reach out to us at findhelpforcancer.com. We'll start with a simple conversation and help point you in the right direction. Happy to help.